a skilled injectionist can smooth a dorsal hump and even make a nose look straighter over the time frame of a lunch.
Although it can be done over lunch, it shouldn't be done over lunch.
Have you personally seen complications from non-surgical rhinoplasty?
Probably one of the worst cases I've seen is there is so much vasculature in there that you can block the vessels that feed the skin. You could be the front desk person one week and be an injector the next. I've seen it happen. That frightens me to no end.
If the injectionist does not catch that there was an occlusion,
You have about 72 hours because the ER 911 isn't going to be able to help you. And so you really need to know exactly the experience level of the provider that you're going to.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Dr. George, welcome. I have been finding it fascinating that a skilled injectionist can smooth a dorsal hump and even make a nose look straighter, and it's simply with filler and basically over the time frame of a lunch. But I also wonder, what are the risks that a patient should be aware of before booking a liquid rhinoplasty?
Oh my goodness. Great question. It's a question that actually brings up a little bit of anxiety for me because although it can be done over lunch, it shouldn't be done over lunch. It should be a very well thought out procedure on both the provider side and the patient side. Let me tell you what I'm talking about when I say that. There are a lot of risky places to inject on the face, but there is nothing more risky than right here in the center.
Okay.
And the reason I say that is all of the vessels, all of the arteries in the nose or around the nose communicate with the retinal supply, with the eyes. So you have the possibility of blindness at its worst adverse event. And so you need to know that you're going to someone that isn't just doing this on their lunch break, that is actually really well skilled, that does this all the time and has the experience and know-how to handle the procedure and handle any problems. So that's probably the biggest thing. I love the fact that we just jumped right into that because really people need to hear that. The thing about it is it can give you some great results. It can smooth that dorsal hump that you were talking about. And I have seen the most amazing transformations. I've done the most amazing transformations on people that is really exciting for a medical provider. And what we really need to make sure that we're talking to our patients about is what their expectations are long term. Because if I don't like my dorsal hump, I should go get a nose job. Like I shouldn't go have a liquid rhinoplasty every year, because every year you go back to your medical provider, you go through all of those same risks.
Fair. I wonder, if it comes down to cost or, because I've heard that this can last up to 2 years.
Yeah. I mean, there's not a lot of metabolism going on in the nose. You don't have a lot of movement. There's not a lot of musculature. So the product is going to sit there. It's going to stay there. It can last for 2 years. So the cost, though, like you really need to look at what the cost is. Like a not liquid rhinoplasty is going to last maybe 20 years or even longer than that, right? So how often would I go in for a $1,000 to $2,000 liquid rhinoplasty in the space of those 20 years? I mean, if you really want to talk about cost. But then the other cost is the adverse event profile. But not that surgery doesn't have an adverse event profile. So.
Okay, fair, but we can certainly math that out. Like, what are the ranges of an actual rhinoplasty that might fix a dorsal hump?
I haven't a clue. I don't do any consultations for non-liquid rhinoplasty, so I don't know. I can imagine that they're in the $10,000 range.
Right.
And it depends on what market you're going to too. If you're in downtown Manhattan, it's probably it could be $100,000. Who
Fair.
knows?
Fair.
Yeah,
Okay. So it might be a math equation, might be an emotional equation.
yeah. I think people have an expectation that a liquid rhinoplasty is more benign, and I caution my patients about that. I don't do a lot of liquid rhinoplasties anymore. I used to do a lot more of them uh, because of the risk profile. I will talk people into actually getting a more permanent solution today.
Have you personally seen complications from non-surgical rhinoplasty?
Yeah, yeah, I
Mm.
have.
Can you
Yeah, I
share?
mean, probably one of the worst cases I've seen. I've never seen a case of blindness, thank God. If that's real wood, I just knocked on it. But probably one of the worst cases I've seen is someone affected the supratrochlear artery, and there was a huge skin necrosis that happened in the forehead, and that it had to be taken care of with a skin grafting and a skin flap. That's just it's right there, front and center in your forehead. It's scary. It's frightening.
Oh my gosh. Okay. So I'm just going to share with the community that you are an advanced practice registered nurse and a doctor of nursing practice. And thank you so much for being with us today and explore the pros and the cons of a 5-minute nose job. Can you tell us about how you got to spending a big chunk of your life as an expert in the aesthetics industry? Did you dream of doing injections as a
You
youngster?
know, it's really funny. I've had the most incredible life, and we don't have enough time in this in this time to really talk about all of it. But when I finally got into medicine, into nursing, I remember I'll never forget the first time I ever heard about anything in aesthetics. And I was an emergency room nurse in Seattle, and there was this guy that was he was a per diem nurse, and he came through. And he drove a Jaguar, and he just he was like, oh, he was extra, right? And I was asking him what he did other than per diem in the ER. And he said, I work in this eye doctor. I work for this eye doctor doing Botox injections. And I was like, oh, like Botox? Is that like what all the movie stars are doing? It was really early on. I mean, this is a long time ago. I've been in aesthetics for 18 years. So this was back in 2004, I think, that I had this conversation. And it wasn't too long after that, maybe 3 or 4 years after that, where I was working in a weight loss clinic, and I started selling Latisse. That was the first thing. Started selling Latisse, and in the weight loss clinic, the lap band was owned by Allergan. So the lap band rep brought the Allergan rep in to meet me, and that's kind of where my start in aesthetics was, and I fell head over heels in love with this process. This medical specialty is perfectly suited for me. It's artistic, it's flamboyant, it's fun, it's medical, it's scientific, it's all of the things that I am. And I have loved this specialty since my first introduction to it. And because I love it so much, because I'm so passionate about it, I want to improve it. And so I'm constantly working at ways to train and improve our specialty.
Okay, great. And that's part of our mission here at Beauty Seek is to train and educate, not train necessarily, but educate via interviews with professionals like you. But you also train. Can you tell us about that?
Yeah, I gosh, I started training. I started training using Sculptra, PLLA, polymerized lactic acid, and this was a while ago. It was long before. It was before it was owned by Galderma, and I fell in love with the biostimulatory effects of Sculptra. I was getting fantastic results with it, and only doctors were able to train on it. And so my rep at the time with Medicis, oh, it was bought by Valiant for just a quick second. And my rep at the time convinced the people at Valiant, because I had a doctorate in nursing, I was a doctor, which I am, I'm just not a physician. So, but they never used the physician with the P word, right? They said doctor. So he convinced them that because I was a doctor, that I should be training on it. And I started training on Sculptra and, continued to fall in love. And then Galderma bought and then I became a Galderma trainer very quickly thereafter. I've been a Galderma trainer for 10 years now. And I love to train. I train for other companies as well. And I train privately. I love to watch the light bulbs go on, Sam. It's just, there's no greater feeling in the world than to take someone that is just fresh into aesthetics and to watch them have their aha moments, whether it's with anatomy or some product that they're doing or some outcome that they just received, that they just got with their patient. It's just, the excitement there is, it's otherworldly. I love it.
I love that. You're living an epic life.
Yeah, I am.
So in terms of your training and considering a non-surgical nose job, who do you think, in terms of the characteristics of who you've trained over the years, who should and who shouldn't be performing this procedure? Because the procedure is going to happen.
Yeah. So if you're timid, if you're an injector and you're timid, and you're unsure of what you're, unsure of yourself doing what you're doing, not unsure of what you're doing, but unsure of yourself doing what you're doing, you shouldn't do it. Just stay away from it. If you're overly confident and overly sure of yourself, and you don't explore anatomy, and you don't explore the intricacies of medicine that we're performing, you shouldn't do it.
Mm-hmm.
The people that should do it are those that are confident and well-educated about anatomy and rheology, that understand the tissue layers and that understand taking care of adverse events. I think that there's a personality type that's really good with doing non-surgical filler. I think when I think about it, there's people that come to mind, and so what I would say about those people is that they know their stuff and they know what to do if things go wrong, and they're willing to take a risk with the patient, because it's not just the patient's risk, it's also my risk.
Exactly.
I guess that's where I got to, though, Sam, as I stopped being willing to take the risk. But there's that too. I'm also a lot older than most injectors. I may not look it because I've been in this business for a while, but I'm going to be 60 in a few weeks. So.
Oh, congratulations!
Thank you.
I love that, and you hit on something that I was unaware of until recently. I was speaking to my injector about, anatomy, education, and so forth, and she said, because I'm in Minnesota. Did you know that in Minnesota, you don't even need to be an RN. You don't need the anatomy education. Can you just talk about that for a minute?
Yeah. Like Texas is the same way, and that's where I am. Texas, Minnesota, Colorado, Idaho. There's Oregon. There's a few states that the legislation or jurisdiction hasn't really caught up with it. And anybody in Texas, you don't have to be licensed to do anything. You could be the front desk person one week and be an injector the next. I've seen it happen. That frightens me to no end. If I ever have the opportunity to speak in a legislative arena, I really will speak out against those kind of behaviors. They're dangerous. What we're doing is medicine. It's aggressive medicine. It's when you put filler into a face underneath the skin, you're putting in an implant. No different than a hip implant or a breast implant or a calf implant. You're putting an implant into the dermis, a dermal implant, and you need to know what you're doing. You need to know what could go wrong. So, for all of the patients out there, ask about the licensure of your provider. Ask about the experience of your provider. Know exactly what training that they have. Ask them who their mentors are. I love that question because if they go, if their mentors are all like Instagram stars, mm, you know, but if they mention, there's a few people that if they mention, actually somebody that's in Minnesota is one of my mentors. So, yeah,
Okay, great.
yeah,
Yeah. So I've done a little research. There's risk, but according to Science Direct, filler-induced vascular occlusion injuries are estimated to occur at 0.01 to 0.05%. So
yeah,
1 in 1,000. So they're going to happen.
yeah.
Can you get a little more specific about what if I were going in for non-surgical rhinoplasty, what could I ask specifically that helps me feel like you really have an understanding of the anatomy? Or should I just point blank say, tell me about your licensure?
Yeah, tell me, so how, what kind of license do you have to do these procedures is a great question that actually you shouldn't need to ask. It should be quite obvious. When I meet you in the waiting room, I say, hi, I'm George Baxter-Holder. I'm a nurse practitioner and I'm a doctor of nursing practice. Come on in. I'm really glad that you found me at Skin Spirit, and we go back to the room. In that 10-second period of time, you found out that who I am and what I am. You haven't found out how long I've been doing this, but then when you sit down, I start telling you that, I've been doing aesthetics for 18 years. I've been with Skin Spirit for 13 years. I'm the vice president of talent development for Skin Spirit. I make sure that everybody's well trained at Skin Spirit. That tells you a little bit about who I am if I make sure that everybody else is well trained. I understand you're here for liquid rhinoplasty today. Tell me about what you know about liquid rhinoplasty, because I want to know what they know about the procedure that they're coming in for. And if they're like, oh, I don't like this hump, and I know that you can put some filler in there and plump it up, like then they haven't really explored, everything. It's going to be a little longer consult at that point where we talk about vasculature and that kind of thing. See, I utilize an ultrasound too if I need to do any mapping, which also it's like, do you have an ultrasound? That's a great question to ask somebody that's about to inject into your nose or anywhere else in your face for that matter.
Yeah, I've looked at some videos with the ultrasound, kind of seeing the veins, and how can you talk about that a little bit? Like, how does that work? Does one person hold the ultrasound? Go ahead.
Well, I don't know, like if you have a bunch of people that you can do it with. I work alone, and so if I'm going to inject under ultrasound, I have to be stable enough to be able to do that. You don't really have to do that. I mean, you can map, like if I mapped your nose and I found out that there's really no vasculature, important vasculature, straight down the middle of the nose, then I can feel a little bit more confident that my needle can go there, right? And so with a good ultrasound, you can see where the vasculature and the architecture of the vessels are. Because there's a couple different patterns that they can follow where they're two running down the middle, one or two running down the side, one down the middle. There's bridging arteries that go across. So, yeah.
And you can feel that.
You can't feel that. Okay. You can, I suppose with a really light touch, you could feel it. You can see it with an ultrasound.
Okay.
Yeah.
Okay.
The other thing that hasn't really been part of this conversation, but I think it bears some conversation around for rhinoplasty, is there's some great evidence from Leslie Fletcher. She's a nurse practitioner in Torrance, California, where she actually uses neuromodulator down the bridge of the nose and gets a really nice result with straightening. It won't do anything with the dorsal hump, so expectations are important, but for straightening a nose or for taking care of some abnormalities in the bridge of the nose, it can work really well. I actually have a kind of a curvature to my nose, and she fixed mine like a while ago. It's never come back. So
really,
yeah.
Neuromodulator. I've heard of it. I can't quite understand what
Uh,
it does.
Most of us talk about Botox when they talk
Oh,
about neuromodulators. Yeah, I just use the generic term neuromodulator. It's Botox, Dysport, Jeuveau, you know, yeah.
okay. Thank you. So let's say I was working with a less trained injectionist. Ideally, they understand the anatomy, and I wanted to work on my dorsal hump. What what are the common, I don't know if the word is mistakes, but maybe the things that, they would train out of as they did more of those procedures that maybe you shouldn't be doing like at all.
Well, I mean, that's a really good question. There's so many right ways to do fillers. You know, I've seen people use little drops on either side of the dorsal hump and kind of build that up because you can't do anything with the hump itself. You have to build up on either side of it, right? Um, so there's people that will put little boluses, little that little droplets along above it and droplets below it to kind of straighten it out. You can also do little threads, you know, along the top too, not threads, but threads of product, threads of filler. Yeah. So there's a lot of different techniques that you can use for doing dorsal hump masking,
Okay.
but yeah.
So there's not necessarily that's a mistake. That's a no-go zone. You should have never touched that unless it was a vein.
Yeah, exactly. I mean, it's the thing about it is, in some people's mind, this is a no-go zone. So once you get away from the whole thing being a no-go zone, then you're left with the if you want to do a little tip lift, and you decide that you want to put filler in the tip of the nose, it's not a benign area. There is so much vasculature in there that can be impacted, and you can end up making a little dead tip, because you can block the vessels that feed the skin. So you have to just be really careful and cautious. This is why knowing what you're doing and knowing what you're doing it with a mentor that's done it before so that you can start to feel confident, is important. But
Right.
it's hard to find, training on liquid rhinoplasty.
Right.
There's a few people that do a lot of it. Mimi Falah in New York. She actually works for Skin Spirit in Tribeca. She's known as the New York liquid rhinoplasty gal. I'm Sasha Rifkin in Beverly Hills. He does a lot of it. He's exceptional at it. He does it. I think he does trainings for it. There's some trainers, a few select trainers, but I would be very careful selecting. Making sure that you're selecting the right trainer to train you to do it if you're a provider.
Right.
Yeah.
So if I were an injectionist coming to you for training for non-surgical nose job, what would the first thing be that you might train me on? What's important for the patient to have success, both safety-wise and results-wise?
Yeah. So the very first thing that I would ask is we would sit down, we would chit chat, get to know each other, have a little cup of coffee, understand where each other are coming from, and the first thing I would ask you is, okay, you just got an occlusion in the nose. Tell me what you would do. And
I thought you were asking me for real.
yeah, no, I mean, if you're coming to me for training, I want to know that on the spot, because that's how it happens.
Yes.
It doesn't happen. I mean, it's not a planned event. It's not on your calendar. Not on your schedule. We're going to have an occlusion at 2:00.
Okay.
You need to know what to do on the spot. And the reason I do it like right after we've gotten all comfortable with a cup of coffee is because that's when it happens, when you're all comfortable. And you need to not freeze, not freak out, be able to go, well, first thing I would do is stop injecting. They always forget to say that. So first thing you do is you stop injecting, take a breath, assess the area, do a visual check, because you want to make sure that and then you can go into the training and how to do the treatment. But the thing about it is it's like I don't even want to start training somebody unless they have that real basic knowledge. Then I want to know about anatomy. So tell me about the anatomy from skin to bone in the nose. Tell me what you know about that. And people will say things like, well, there's always a vessel that goes right down the middle. It's like, really? There's always a vessel that goes right down the middle? Yeah. Because you can't say always and vessel in the same sentence.
Yeah.
Yeah.
They're unique. They have unique paths, right?
Yeah. And I've dissected enough cadaver heads to know that everybody's just a little bit different and when it comes to vascularity. So I would probably be a tough trainer for if somebody came to me to get trained on liquid rhinoplasty. You know, the biggest takeaway message I would say is make sure that this is something you really, really, really want to do and you want to specialize in, you want it as your niche. Because you should be doing it all the time, you know?
Exactly. Yes. Practice makes closer to perfection. Got it.
Yeah. Yeah.
If the injectionist does not catch that there was an occlusion as a patient, what would the signals be to me where, oh gosh, there's something wrong. I should act in some way.
Are you talking about during the treatment or after the treatment?
Yeah, both. Exactly.
Yeah.
I think both are critical timeframes, right?
Yeah. So there's a level of pain that happens when you're getting injected. I'm not sure that you've had injectables, but I think you wouldn't be having this conversation if you hadn't. You know what I'm talking about. You know, there's a level of pain. It's not horrific. If the pain is more than that, you should say something to your medical practitioner because they need to know that there's pain out of proportion to the procedure. So that's number one, because many times there's nerves that are going to follow arteries specifically, and so if you've occluded or if you've damaged an artery, there could be some nerve pain along with that. But that's not, you don't have to have pain, so it could not be pain as well. Definitely, if there's any visual disturbance, like if you even see a little flutter or anything like that, I would make them stop and reassess as a patient. Some of that can be anxiety, you know, and that's fine. But there's no downside to making someone stop, right? So after the treatment, the pain that you had during the treatment should start going down. It shouldn't go up, and especially it shouldn't go up too far. So if you start having pain out of proportion with the treatment, you should make sure that you let your provider know. If there's a bruise that just doesn't look, I mean, it's kind of a gut thing, you know, a bruise has a particular look to it, right? But an occlusion that you think is a bruise has a little different look to it. So if there's something that just doesn't look right from a bruise perspective, my rule of thumb is consider it an occlusion unless proven otherwise. So they should come back and see me, and we need to take a look at that. If there's any skin abnormalities, like even pimples, like if you start to see pimples or little liquid-filled vesicles, that's impending necrosis of the skin.
Really?
So and people will go to the ER. They'll show up at the ER, and the ER will think it's herpes.
Oh,
and so then they'll treat them for herpes, and you know, well, I had filler the other day. Oh, you probably are having a herpes outbreak from like the trauma from the filler. No, it's skin breakdown, and you're about to lose the tip of your nose. Okay. Yeah.
Oh gosh. Okay. And then what is the timing? Go ahead. Like how much time do they have before you need to treat? Or
it's an urgency, not an emergency. So this is why I say don't go to the emergency. Make sure you get a hold of your provider, and any good provider. If your provider doesn't provide you a way to get a hold of them after treatment, go somewhere else. You know, it's really important that you can get a hold of your provider that night. Mm-hmm. And maybe it doesn't have to be that provider, but a provider. Mm-hmm. You know, so maybe they have a system in place where they have someone else for you to talk to. But you have about 72 hours till it's really, past the point of no return.
Okay.
So it shouldn't go, it can go the weekend, but it shouldn't go till Tuesday, right?
Okay.
You know what I mean? So if you had it on a Friday, it can probably go to Monday, but you should get a hold of somebody if you can the next day.
What do you suggest for clinics who might have on their voicemail over the weekends because they want to live their life, right? But maybe they injected someone on Friday and, the autoresponder says, if this is an emergency, call 911. I'll talk to you on Monday. What do you do?
Yeah, your autoresponder shouldn't say that. Ours doesn't say that. It's conspiracy. Like I take the call. Like
You do.
we have a system in place where we have after hours providers that will answer the call because the ER 911 isn't going to be able to help you. They literally, this is an area of medicine that most clinicians have never dabbled in or delved into. And an ER physician is a generalist and they're fantastic. I mean, I worked in the ER. I love my ER colleagues, but if a facial artery occlusion or a dorsal artery occlusion, like they're not going to know exactly what they need to do with it.
Okay. Okay, this is fascinating. This really does kind of set expectations in terms of the communication that I should be able to have, at my aesthetic clinic. I need them to be available for me if there's an emergency.
Yeah. The thing about it is like not all clinics have that set up or have that system in place, and they really should. But I don't need to go to any clinic either. So if I go to a clinic and I don't feel good about the way they're going to take care of me, should anything go wrong, I shouldn't get treated there.
No, exactly.
Don't wait till something goes wrong to find that out.
No, exactly. Just in terms of the results, if you're feeling comfortable with your physician, they are available on the weekends, and then we're talking about results, maybe specifically for, a dorsal hump. What would they be saying, or how would the injections be commenting to kind of help a patient feel like, the results that I want are achievable, or no, we shouldn't even try? Like, how do you kind of get a sense of that?
Yeah, I mean, it all depends on what you're asking for. What I would do in my clinic is I would take pictures from multiple different angles. Then I would sit down with the patient and the pictures. Not try to do it with a mirror, because you can't get a side view in a mirror. So I really want to say, okay, what is it that you're trying to accomplish? Oh, I hate this here. Look at this bump in the middle of my nose. This is what I don't like. Okay, so in order for me to accomplish that, and I would, maybe take a little dry erase marker, I would add a little filler here, and I would add a little filler here, and your nose would get higher to match where that hump is. Now, what will happen from that is when people are looking at you, and that has happened, your nose will look thinner because it's higher. But from the side, it'll be higher to match that hump. So I have those conversations where people really understand what it is that I'm going to do to accomplish the perception or the look that they want. Because a lot of this is about light, where the light hits. If you're trying to straighten a nose, you're trying to get the light reflex straight, right?
Yes.
Lights and shadows. That's what we do.
I love that. I mean, it really is an art. This is an artful industry.
Yeah.
How, if you were consulting then with a patient and they just kind of kept pushing in terms of like, this is the result I want, and you're trying to explain that, you might get a bit of that result, maybe not all of it. At what point would you kind of kindly say, we can't do it. We can't achieve your objectives? Or
I've got a pretty low bar, a little pretty low threshold for that pushback. Because unless it's another injector coming to me that knows that I can get that result, right? I want to know where they've gotten their training from that gives them the expertise that can tell me that I don't know what I'm doing, So like I would say, like I could probably get you 30% there to what you're looking for. I mean, is that percentage enough for you?
Mhm.
And if they're like, well, no, I really want it straight or I really want it flat, I'm sure you can do that. It's like, well, I'm not sure that I can do that. And I don't think that I have the skills to make you happy.
Okay.
I love that line.
I
It's
don't
my
know.
very favorite. If you hear that line from me, just stand up and walk out.
There's no going back. You do
There's
have
no
the
going back. Yeah. Because like, you know, and I get this not just with liquid rhinoplasty, but with other things where people come in with really out of line expectations and they're expecting a surgical result from a needle and I can't get them that. And no amount of arguing with me is going to make me be able to get you that. And it's at the end of the day, it's my business card walking out the door. You know, that's my work, and I want to feel good about the work that's walking out the door. And if I can't, then I don't have the skills to make you happy.
Yeah, absolutely. So what would you say, a little off topic, is the procedure, the treatment that expectations are always this high and they need to be reduced to this high? Is there a common, like, here's the treatment that expectations?
Right here. It's this area for my favorite patients. My favorite patients are like me. My favorite patients are, 50 to 70. And this has just gotten sun damaged and wrinkled, and there's little adhesions for the marionette crease. And when people when people want it smooth right here, there's just so much to do that it's that people get really out of whack. But what I do is I really prepare them for horrible bruising, because what I want to do in this area is, even me, you can see this right here?
Yeah.
This is an adhesion where there's a little grab from the surface pulling that down. I need to get in there and I need to break that up. And so that's going to cause a bruise, right? But once I break that up, then I can start, really providing some smoothing in here. But that happened over years.
Really?
So, yeah. So, when people are like, I just really want this smooth, it's like, oh, you really can't probably get that smooth.
And for our listeners who can't see us, we're talking about the area all above the lip and to the
Yeah. Sorry about that. Yes,
No.
I'm talking about there's smokers lines above the lips. There's lines that form around the mouth as we talk, and if you look into the mirror while you're listening to this, and you kind of move your mouth while you're talking, you'll see little creases form, and those creases form because there's something tethering the skin down. Yeah.
Okay. Yes, I've just been sensitive to these little channels that I'm starting to see above my lips, and I think we started to put a little Botox at the very top of them. And I don't know if we tried just a little PRP, but I was relatively happy, although when I spoke, I would be lisping a little bit.
Yeah, that's from the neuromodulator, definitely. Yeah.
Okay.
Yeah.
Well, let's see. If there's one thing that you wish every patient understood about non-surgical rhinoplasty, what would that be?
Yeah, so the one thing that every patient needs to understand is it's a very serious procedure. It's not something that's frivolous. It's something that can have a beautiful result. I hope that I haven't scared off your listeners from talking to their provider about it. Non-surgical rhinoplasty. I think everyone still that wants to get some augmentation there should definitely have that conversation. And because I think you can learn so much from the conversation, but just know that it's not like, oh, I think I'm going to take my lunch break and go get my dorsal hump reduced. It is way more serious than that, and it needs to be taken with the seriousness of a surgery, because the possible adverse events from that are very, very serious, and people need to go into it eyes wide open. That's really what informed consent means. I think people misunderstand. A lot of people, myself included, will just sign forms in a clinic visit. It doesn't matter what it is. Yeah, no, I trust you. Whatever. The thing about it is your provider, when you sign informed consent, you're signing a document that says that your provider told you told you with their voice, told you all the problems, all the things that could happen.
Mm-hmm.
And if you go to see a provider and they're going to do filler on you and they don't say that blindness is in the realm of adverse events, you should run them the other way. Because they really need to make sure that they're telling you everything.
Question, do you need to sign a form before every procedure, or is it a year annual thing if you're coming in, or how does
Different states have different legalities. We have our providers have a consent the patient every single time.
Okay.
It's just good practice. It's just good medicine. This is taking medical aesthetics seriously and not treating it like it's a beauty procedure. I mean, my hairdresser doesn't have me sign a consent every time, but I do if I'm going to go into have a procedure, medical procedure. And so it's important that we talk to our patients about risks and benefits. There's a lot of benefits. This is a fun field. These are great outcomes. I don't want to scare anybody off, but it also is serious medicine.
It is, and we're all about awareness, straight talk, so that beauty seekers like me, so we can make more confident, informed decisions. So I thank you so much for helping to educate our community. Question for you, because we talked a lot about patient safety, and as you look back over your career, what does patient safety, or kind of doing no harm, like what you kind of promised at the beginning of your career, like how has that changed for you from the beginning of your career to today?
I'm a little embarrassed to admit some of this, but I'm going to admit it anyway. So I started my aesthetic career. I had a makeup kit with on rollers that I would take my Botox and my fillers, and I would roll it into people's dining rooms, and I would set it up at their dining room table with whatever lighting they had, whatever chair they had at their dining room table, and I would stick fillers in their face, and I had no idea of the problems that could happen, and I had no idea of the solution to those problems. I don't know if at first I was having them sign consents. I can't even remember if I had all the full forms for that. But I have swung completely the opposite way now, as you can tell from this conversation. And I think patient safety is so critically important. It starts with, I believe that providers should have hands-on cadaver anatomy before they ever touch a patient in medical aesthetics. And I put my money where my mouth is. I teach in cadaver labs that all the providers that I work with at Skin Spirit have the opportunity to go to hands-on cadaver labs. We're actually having one in a couple weeks in Chicago. We're bringing 40 of our providers that have never had hands-on cadaver lab together, and Chris Surik is doing a cadaver lab for them. So I think that's really, really important for patient safety. That's the foundational level for patient safety. We have no standards in medical aesthetics. We're pretty much a fledgling specialty, but we have to create our own standards. And so as a professional, as one of the old guys in the industry, I need to suggest, because of my personal experience, what those standards should be. And so, I'm happy to help create the standards for our industry, but we all need to say, yes, I will live up to those standards. I think I agree with George. I think that is what needs to happen. So things like cadaver anatomy, the utilization of ultrasound, understanding patient safety, understanding adverse event protocols, understanding the rheology of the products that we're using. All of that stuff is so important on the provider side. And then that relationship that we build with the patient, there's nothing more special than the relationship with your patient.
Yeah, it's true. The relationship, yes, it's the art and the science and the relationship. Exactly. I want to come to cadaver training. Can I come?
Yeah, we can get you into a cadaver.
Yeah, I love this whole industry. I love all of the surgeons and practitioners that I'm speaking with. They definitely support, kind of the art and the science, and like you said, what did you say? The flamboyancy of,
Yes, yeah, that's part of it for me. It's just that's who I am.
yeah.
Just as a person and a provider. And I really appreciate the work that you're doing, Sam, with really educating people and getting people to to listen and to understand just a little bit more, even if it's just you know one podcast at a time or one webinar at a time. I think that's fantastic, and I really applaud you and the work that you're doing.
Thank you, Dr. George. Thank you for sharing not just your expertise, but your judgment, your assessment. You've been, kind of so open, and conversations like this, I'm hoping, help patients and clients understand that, experience isn't just, not about what you can do, whatever practitioner you're working with, but also what they shouldn't do. So we appreciate your time and your commitment to patient safety. Thank you.
Thank you.
We acknowledge Dr. George for contributing his professional insight to this interview. Expert perspectives like his support informed discussion around aesthetic procedures and beauty literacy.